Australia is set to receive an international supply of anti-malaria drugs as coronavirus cases surpass 5,000. Federal Health Minister Greg Hunt has confirmed the nation is well equipped to deal with a rise in cases as the government quadruples ventilator capacity.
It's a disruption to life as we know it, but there are early signs the curve in Australia is flattening.
Going from 25 to 30% daily infection rate growth down to the low teens and now safely below 10%.
As we head into the cooler months, the government is working to quadruple the nation's supply of ventilators, so no region is left vulnerable.
We're expecting to have about 7,500 ventilator ICU beds that are ready and available for even the most difficult of circumstances.
And there are positive signs in the race for a COVID-19 cure.
We've just had confirmed from overseas overnight that one of the international manufacturers will provide 2,000 courses for Australian patients of hydroxychloroquine. Their condition is that it has to be used in hospital on patients. It will now be a matter, once we have these stocks arrive, for the individual doctors and hospital systems to determine whether it's appropriate, whether they believe it's safe. But there are multiple trials going on around Australia.
An anti-malaria drug originally, it's been around for a long time, at least 50 years. There are some clinical trials that have started in Australia and elsewhere in relation to this. Some early work done in France is positive, but very preliminary.
Researchers at Monash University have discovered an anti-parasitic drug used to treat head lice can kill COVID-19 in a lab setting in 24 hours.
Now, there's no reason to be buying lice treatment unless you're going to use it on your children's hair. We have seen people overseas who've heard about potential developments and have then ingested drugs that have been used in a completely inappropriate way and have died as a result. So I don't want to see people rushing out to their pharmacies or their supermarkets buying lice treatment now.
Minister Hunt warns now is not the time for complacency as we face a difficult 6 months ahead. He admits the national caseload would be significantly higher if not for social distancing or self-isolation rules. Julia Bradley, Sky News.